Okay, now we're going to talk about a challenging case. This young guy did the same thing as I showed you in that woman. We took out the first and second molar. You've got the gap here, and that's the thing to notice. We've got our bone gap right here immediately post placement. When the case is finished, this is what it looks like with absolutely no bone graft. Most importantly is that these two are splinted together to enhance long-term stability and less likelihood of loss of the implant long-term. And this is what you see clinically. And here we've got a 63-year-old male, benign medical history, but multiple severely decayed teeth. His wife had already underwent multiple implant procedures with success. So that's the typical story. They send the woman as the guinea pig, and then okay. If you take a look at this x-ray, you can see he's got multiple decayed teeth, particularly his molars here, and another broken down tooth up there, another molar over here. And so they're all in trouble. If you look in his mouth, clinically, you can see this is a big mess. So what we do with a case like this is get the teeth out, right? Okay, and at the same time, in at the best locations we can. And you can see we have 6 implants here in this case. Clinically, once you got the idea of what a toothbrush was all about, okay, this is how the healing progressed, and you can see that we've got, even without attached tissue around these healing abutments, everything appears, and so uh, it does work even in the, and this is just another example of how healthy things got once the bad teeth were out. So how does the case go? This is the typical scenario in my office. You have the appointment where you get your tooth out, the implant placed. 85% of these cases are done under local anesthetic. You come back a week later and the stitches are left in place. You come back at the second post-op week, 14 to 17 days, and the sutures come out. Come back for a third appointment at about 45 days, which is just a checkup to know that things are going well. If an implant is not going to integrate, you usually know by this time, or at least have a pretty good idea that that's the case. And then you come back at the 90 days post-op, 3 months, and you do what's called a torque test, and I'll show you that in just a moment. And if that is successful, you can do scanning right on the spot or send the patient back to the dentist for uh, the impressions that are necessary. And after the 90-day point, we bring them back in 3 months to see the finished product. Hopefully it's done by then. In most instances it is. Restorative considerations, intraoral scanning versus conventional technique, they're equally accurate, and patients really like the scanning as opposed to having impressions taken. Doing the scanning streamlines the case, gets people committed to treatment and completion much faster. Uh, and we automatically torque test and scan at 90 days, and crowns are placed approximately 3 to 4 weeks later. And for the dentist, it cuts his costs somewhat, and the